Okay, Paula.
Welcome to the Lourie Center's annual educational event. We picked this day in particular to hold our event, not just because it's Cinco de Mayo. You might know that May is National Mental Health Awareness Month, and today is Children's Mental Health Awareness Day. Our program is hosted by the Lourie Center's Champions for Children, which is a network of women who come together to inspire, influence, and leverage their experience and relationships to move from awareness to action by raising funds and supporting the Lourie Center as a model of early intervention success. My name is Paula Weiderlight, and I'm proud to say I'm a founding member and the current lead for the Lourie Center's Champions for Children. I want to thank you for joining us. By being here today, you have already made the first step from moving us from awareness to action. I'm excited for the program we have for you. I'm delighted that you'll hear directly from our National Honorary Chair, Tami Benton, the Executive Director of the National Basketball Players Association, and a role model when it comes to community outreach, and one of the most tireless advocates we could ever have for the children who come to the Lourie Center every day. I'm also thrilled that you will hear from our panelists who are leading experts in the field of children's mental health. They are the true champions helping our children and families to confront adversity, trauma, and to work towards a future where they can thrive. In addition to Tamiko, our panelists are Dr. Marilyn Pao at NIMH, Dr. Tami Benton from the Children's Hospital of Philadelphia, Dr. Marissa Leslie from Adventist Healthcare, Breen Mack, Vice President of Education and Teaching Strategies, and Ingrid Burford, a parent whose story will inspire you. Speaking of stories, let me tell you the story of Champions for Children. In late 2020, the organizing concept was introduced to galvanize women to take action in support of the Lourie Center's mission. It wasn't hard to collect these women. It seems like there's not a day that goes by without a story in the media about the devastating effects the pandemic is having on the already stressed lives of our children. In April 2021, just 1 year ago, we got to work and decided to focus on assisting the Lourie Center in 3 ways. First, by supporting the professional development of our staff and clinicians who teach and care for our children. Second, by replicating the Lourie Center's model of early intervention and healthy attachments through programs such as Circle of Security and Project Echo. And third, by building new access points to the Lourie Center. First in the Washington, D.C. area, then our vision is that there be a Lourie Center, physical or virtual, in every community. In our first year, Champions for Children has raised nearly $250,000 through grants, corporate sponsorships. Thank you, Deloitte and Tamika Tremiglio, Cigna and Monica Schmoody, M&T Bank, Cecilia Hodges. Thank you to the Healthcare Initiative and Marta Perez. And for the individual gifts, thank you, Champions, with a special thank you to Kylie Burke, whose personal gift was one of the largest in the Lourie Center's history. And while I'm handing out thank yous, thank you to our lead champions who have been helping us get organized this past year, and former board members who have stayed engaged with us. Lynn Carbone, Louisa Holman, Diana Eisenstadt, Gwendolyn Mason, Marianthi Hatzigiorgio, Helen Delheim, Wendy Kish, Jackie Berman, Maureen Diamond, Nancy Reller, Hillary Baltimore, Rebecca Bennett, Lori Zell, and Kendall Seismeyer. We are also so grateful for the support of our fearless Executive Director, Jimmy Benza, for Alan Ezawi, the Lourie Center's Chief Development Officer, and for Charisse Callahan, who assists us when she's not keeping Jimmy on track. Our goal is to raise $1.8 million, so there's still plenty to do. If you're interested in joining us because you're a woman who wants to get things done and wants to make an impact, if you're a young professional and you want to get involved, or if you know a woman who fits that description, please reach out to me or the person who invited you here today, or to Alan Ezawi at the Lourie Center. We'd love to count you as a champion. Now it is my honor to hand the rest of the program over to our moderator, Dr. Marissa Leslie. Dr. Leslie is the System Medical Director of Psychiatry for Adventist Healthcare. She's an assistant professor of clinical psychiatry for Georgetown University School of Medicine. She specializes in treating depression and PTSD in children and adolescents with an academic interest in immigrant and refugee trauma. She has worked with youth in her personal life as a big sister and youth club instructor. and she believes in the ability of every child to thrive and succeed with proper support and mentorship. Dr. Leslie?
Thank you. Thank you for that introduction, Paula. And thank you for all you do to support the Lourie Center through Champions for Children. Also, thank you to all of you attending who have taken time out of your day to learn more about the crisis in child mental health. We appreciate your interest. Participating in today's event are our two featured speakers, Dr. Tami Benton and Dr. Marilyn Pao, and three additional guests, Ingrid Burford, Brian Mack, and Tamika Tremaglio. You won't want to miss what they have to say at the end. We will first hear from Dr. Benton and Dr. Pao. We will follow those presentations with a short question and answer, and then hear from our three other guests who will speak about their experiences in addressing child mental health. Before I introduce our speakers and guests, I want to talk about the adversity so many children are facing and its long-term effects on children, if not identified and addressed in these early years. In December 2021, the United States Surgeon General, Dr. Vivek Murthy, said the following: "Mental health challenges in children, adolescents, and young adults are real and widespread. Even before the pandemic, an alarming number of young people struggled with feelings of helplessness, depression, and thoughts of suicide. The COVID-19 pandemic further altered their experiences at home, school, and in the community, and the effect on their mental health has been devastating. The future well-being of our country depends on how we support and invest in the next generation." And just to bring you some facts which are startling, 45% of all of us have experienced at least one adverse childhood event. Females and people of color are at greater risk of experiencing 4 or more adverse childhood events. 17% of us have 4 or more, which is linked to 7 of the top 10 leading causes of death. And for example, what are those leading causes? Heart disease, cancer, respiratory diseases, diabetes, and suicide. Children with a high number of adverse childhood events and who do not receive early intervention have these stats: 300% more likely to be expelled from preschool, 40% of girls experiencing teen pregnancy, 60% more likely not to attend college, 70% more likely to experience incarceration. And these children are 2 to 5 times more likely to attempt suicide. The crisis in child mental health has been evolving for some time. The COVID pandemic compounded the problem, but also brought the crisis out of the shadows and into the light. We have with us today 2 speakers who are experts in the field of child mental health. The ways in which COVID has exacerbated an already existing problem and what is being done to address the problem. We have Dr. Tami Benton and Dr. Marilyn Pao. Dr. Benton is the Psychiatrist-in-Chief, Executive Director and Chair of the Department of Child and Adolescent Psychiatry and Behavioral Sciences at the Children's Hospital of Philadelphia. Dr. Benton's areas of expertise include pediatric mood and anxiety disorders, ethnically diverse children, health services research, psychiatric aspects of chronic medical illness, psychopharmacology, and eating disorders. She completed her postgraduate training, internship, residency, and fellowship in triple board training program in pediatrics, general psychiatry, and child psychiatry at Albert Einstein College of Medicine, Montefiore Medical Center. Dr. Benton has extensive clinical and research experience in the assessment of children and adolescents with mood disorders and suicidality. Dr. Benton is currently the president-elect of the American Academy of Child and Adolescent Psychiatry. And in addition, she is my mentor She was my training director, and I consider her a wonderful friend and example and fierce advocate for child mental health. Dr. Marilyn Pao is the clinical director of the National Institute of Mental Health Intramural Research Program at the National Institutes of Health. Dr. Pao is also the Deputy Scientific Director for NIMH. Dr. Pao completed pediatric and psychiatric residency training, as well as a child and adolescent psychiatry fellowship at Johns Hopkins Hospital. She is board certified in pediatrics, general psychiatry, child and adolescent psychiatry, and psychosomatic medicine. Dr. Pao is on the clinical faculty at Georgetown University, George Washington University, and Johns Hopkins University Schools of Medicine. So if a question comes to mind during either Dr. Benton or Dr. Pao's presentation, please write it in the question and answer box. The Q&A icon is at the bottom of your screen. You can elect to send the question anonymously if you prefer. At the close of Dr. Pao's remarks, we will have time for Q&A. If there isn't time to answer every question, we will send answers via email. And remember, stick around after our esteemed presenters. You won't want to miss what's after that. Now, it's my honor to turn things over to Dr. Benton.
Thank you, Marissa, and thank all of you for this invitation. And it's so nice to be introduced by one of my mentees. Marissa, it's nice to have you introducing me. So thank you very much. And I'm really thrilled to be here. I want to talk with you today a little bit about kind of what's happening with children's mental health in our nation. Some of this you may be aware of. It'll be a brief introduction, but I want to hit the highlights for you today. And if you have any questions, I'd be happy to follow up. Next slide, please. So I want to talk a little bit about mental health broadly. I think we all know what it is. But I think it's important for us to remember that mental health conditions occur on a spectrum or on a continuum. And so having a mental health condition is not a sentence to have an unhappy life. Mental conditions run on a continuum from fully thriving to severe psychological and psychiatric disorders. But we have treatments that can alter the course of those disorders. It's also important to note that having something go wrong in our lives does not mean that we won't be successful in our lives, that things that go well predict success, and that things that go wrong doesn't necessarily mean that we won't be successful. In fact, failure is an ingredient for success. And I also want to highlight that our overall goals for all youth is well-being and flourishing. And that's not just not having a mental health condition, but that's being able to live to your full potential, utilizing your resources for your growth and development. Next slide, please. So just to give you a broad overview of what we know about mental health conditions for children, we know that 1 in 5 children will endorse having had a psychiatric disorder within any given year. And about 1/3 of youth will experience a psychiatric disorder within their lifetime. We also know that psychiatric conditions begin early and that about 50% will have had the onset of their disorder before 14 years of age. And for those who are identified as having a psychiatric disorder, we know that only less than half will receive the treatment that they need. And for those receiving treatment, the average delay between the onset of symptoms and treatment initiation is about 10 years. And that's significant because delayed treatment results in worse outcomes. Next slide, please. So child and adolescent mental health is a significant public health problem. There currently are estimated 74 million children in the United States. So if you think about those numbers, that's actually quite significant. They make up about 22% of the US population. So that's not exactly a small minority. So when we think about that number of children, with 1 in 4 having some mental disorder with severe impairment. And remember, impairment is one of the criteria for something becoming a disorder. We know that mental health conditions are even more prevalent and more common than all of our medical conditions. And partly that's because we've actually found cure for quite a few of the medical conditions for young people. But it's also true that it's much more common for young people who have a chronic mental health medical condition also have a mental health condition. And when we think about the scope of the problem, 73 million kids, we spend close to $300 billion each year on treating childhood mental health disorders. And many of the young people who are being treated are not receiving evidence-based treatment. And also remember, a significant proportion of children who need treatment are not receiving it. Next slide, please. So the good news is that mental health conditions are treatable, and many times they're preventable. And though I won't speak much about prevention in this presentation, prevention is where we should be placing our research and focus. It's cheap, and it prevents the onset of mental health conditions. And there's lots of evidence-based preventive interventions out there. But for those people who are struggling with mental health conditions, we have psychotherapies that will bring you to remission. And they're available for every mental health condition impacting treatment. And pharmacotherapies are available for those who don't respond to psychotherapy or for those who need more than psychotherapy. And then, as I mentioned, we have parenting interventions that prevent the onset of mental health conditions, but also for young people who have mental health conditions, we have interventions, preventive interventions that can decrease relapse for those who are struggling. And then we also know that we have opportunities to expand access to prevention in primary care, in schools, and in other community settings. So houses of worship, churches, spiritual communities, recreation centers, daycare centers are all places in homes where preventive interventions can be put into place. Next slide, please. So what's happening out there? And, and what is it that we're referring to when we talk about this crisis? So one of the things that most of us in this audience know, either from our professional experience or our personal experience, that despite the fact that all these interventions exist, people can't get access to them. So, it's about 22% of children who need specialized mental health care actually receive it. And even if they don't receive the follow-up care, only about 20% actually receive a mental health evaluation. And that's for youth who are identified as needing one. So that doesn't count the youth who are not even recognized. For most youth who receive their care, they're actually not receiving their care in specialty mental health clinics. They're receiving their care in schools. They're receiving their care in general medical settings. And unfortunately, a large number of kids who are struggling with mental health conditions receive their care in juvenile justice settings. And then there are other settings like child welfare where children receive mental health services as well. But actually, many of these things could be prevented if they receive care excuse me, at the time that they needed it in the right place. We also know that untreated mental health conditions are often disabling. And the longer you delay treatment, they can be more difficult to treat. Next slide, please. So I just want to highlight for you some key facts. I don't necessarily want to highlight a bunch of bad news, because highlighting the key facts doesn't mean that we're not in a good place to prevent a lot of the things that are harming young people. But I think it's important for you to know some of the indicators that have flagged for individuals that we're not really doing well in our efforts to treat young children. I'm sorry, can you hear me? I seem kind of frozen.
Yes, we can hear you.
Okay, great. So suicide is the second leading cause of death for young people ages 10 to 14 years, and I'm sure you're aware. It's the first leading, but what you may not be aware of is that as we've learned more about suicide for young people, we're starting to find significant disparities in how young people are affected. So the conventional wisdom in mental health used to be that really you only have to worry about Caucasian youth because that's where the suicide deaths occur. But we actually know that's not true. And the demographics have shifted considerably. And this is very important when you consider the population demographics of the United States. More than 50% of youth under the ages of 18 identify as minoritized youth or multiracial youth, and that's relevant. What we're seeing is that for Asian American youth between 15 and 24, suicide is the leading cause of death. And when we look at rates of suicide increasing over time. We find that non-Hispanic Black and non-Hispanic Asian American, Alaskan Natives, and Native American people are experiencing increases in their suicide rates. We also know that for youth who identify as gender non-conforming or sexual minorities, their risks are higher, and that becomes more true if they have intersectionality or membership in more than one group, a sexual minority or ethnic or racial minority. And most disturbing is the fact that suicide rates have been increasing at the most rapid rate for Black boys between 5 to 11 years of age. And suicide rates are also increasing for Black girls. And what's not included on this slide is the fact that the leading cause of death for Black youth between the ages of 15 and 24 is homicide. For every other age group younger than 24 among Black youth, homicide is the second leading cause of death. And when you look at the morbidity mortality charts, those numbers actually start from starting at 1 throughout the lifespan. And so for Black children, homicide is the leading cause of death. Next slide, please. So why is it that we have evidence-based treatments, we have preventive interventions, but people aren't getting better and our suicide rates aren't going down? Barriers to care are some of the reasons those are happening. We'll spend a few minutes talking about what those are. Next slide, please. So we've all recognized that there's significant barriers to patients getting what they need. There's the wait times, there's the multiple appointments, there's the shortage of clinicians, there's discrepancies in distribution of clinicians. So there are virtual mental health deserts across the United States, places where there are no mental health providers. Payer fragmentation, insurance is a problem. Parents should be able to look at the number on the front of their insurance card, call and get verification of their benefits, but they're not able to do that because sometimes there are 2 or 3 payers managing their care. Our clinic hours aren't friendly. Why do we run our businesses from 8 to 5 when people need to be at work and kids need to be at school? And then there's also stigma. So even if people have access, they often don't seek treatment. And then people also don't know. So many times we don't recognize symptoms of mental health. And then other times, if we do, we're not exactly sure, how we can access care. Next slide. We also know that for minoritized youth populations, they're significantly less likely to receive care, either specialty mental health care or general medical services. And this is especially concerning in the face of trauma, which tends to be more prevalent among minoritized populations, particularly Black populations. And then minoritized youth in general are much more likely to be overrepresented among the poor and on Medicaid or uninsured. They're much more likely to receive their care in emergency departments and less likely to receive follow-up care. And we know that these failures from a systemic perspective have resulted in worse outcomes for minoritized youth. Next slide. Other factors, we know there are national shortages. And so there's about 8,000 child and adolescent psychiatrists in the US, about 25,000 clinical child psychologists. That may sound like a lot, but it's not, in part because more children will need psychotherapy than will need pharmacotherapy. And psychotherapy has multiple visits. The numbers of developmental behavioral pediatricians are even smaller. And as I mentioned, there are geographic disparities. So when we think about what does that mean, 8,000 child and adolescent psychiatrists, well, it's in Pennsylvania, that's 25 child and adolescent psychiatrists per 100,000 people. In Boston, which is identified as an area that's well supplied, it's about 35 per 100,000. And in your area, I think in DC, there may be maybe 15 to 20, maybe 20 child and adolescent psychiatrists per 100,000 youth. Clearly not enough. So there really is a shortage of clinicians. Next slide, please. So the data that I just gave you was before the syndemic of COVID-19 and racial unrest and social unrest in our country, okay? But things have gotten worse since the start of this syndemic. Next slide, please. Okay. The occurrence of COVID-19 highlighted significant problems with our mental health care system overall. So it highlighted the shortage of providers and the absence of care. It highlighted disparities in care. And COVID-19 didn't create the problem, but it definitely highlighted some of the struggles that we were having and made them worse. Next slide, please. So one of the things that we observed during COVID-19 were significant racial and ethnic disparities in mental health and substance use treatment. And given that, the people that most affected were minoritized populations related to psychosocial stress and other social determinants of health, such as poverty, lack of access to resources, poor health, were at increased risk related to any stress to a system that was already stressed. We also know that minoritized youth are much more likely to experience trauma and traumatic loss related to COVID-19. They're much more likely to have more than one adverse childhood experience. They're more likely to receive their healthcare in the emergency department, and they're much less likely to be followed for follow-up professional care, and much less likely to be treated in traditional mental health systems. And unfortunately, given the increased homicide rates among minoritized youth, the reality is that handguns have started to gain in prominence as a source of suicide among minoritized youth populations as well. Next slide, please. For LGBTQI plus youth, we're seeing similar trends. And this data is actually from the Trevor Foundation study that actually occurred during the pandemic. And what they observed is that for Native Indigenous youth, Black youth, multiracial youth, Latino youth, and Asian Pacific Islander youth, who were also identified as sexual minorities, had increased rates of suicide attempts in the past year during the pandemic, suggesting that the mental health of this population worsened during the pandemic. Next slide, please. So I want to talk a little bit about what we can anticipate going forward. And we have opportunities to respond in a way that's preventive and will prevent some of the poor outcomes. So we know that in the United States through 2022, more than 200,000 children lost caregivers to COVID-19. And we also know that that's an adverse childhood experience that can have long-term adverse impact. We also know that age matters. So about 75% of those youth who lost parents were adolescents. About 25% were children under 10. We know that young children have higher daily and moment-to-moment care needs. We know that adolescents are making that transition to adulthood, making them at greater risk for exploitation, and for younger children, placing them at greater risk for developmental disruptions. We also know that even though Black youth represent about 14% of the total population, they made up 20% of the youth who experienced parental loss. And we also know the circumstances under which children lost caregivers during COVID are unique and unusual. Many times children had who they perceived to be healthy family members who went off to the hospital and just never came back. So all of those practices and rituals that allow us to grieve loss appropriately didn't happen for the majority of children. But the good news is that we have interventions that are supportive of children who lose their parents, and a proactive approach where we take a preventive perspective to provide those resources to children can shift the outcomes. Next slide, please. So next slide, this is our call to action. Okay, and I want to highlight this. Next slide, please. I wanted to highlight this particular sequence of events because I want us all to be aware of what has precipitated this declaration of a children's mental health crisis. As I mentioned before, the reality is that we were struggling long before the pandemic, and this has been going on for some time. But the recent events have really highlighted the challenges to providing mental health care. COVID exacerbated that. So in this year, between April of 2021 and March of 2022, there has been more attention and action around these issues than I've seen in my more than 25-year career. And so starting with the Senate hearings back in April of 2021, several events have happened. There have been multiple Senate hearings. There's been the Surgeon General's advisory that was released in December of 2021. There was a national declaration of a state of emergency in children's mental health by the three largest providers of care for pediatric populations, the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and the Children's Hospital Association. All of these activities together resulted in the recommendations by the president in his State of the Union address to support these initiatives focused on children's mental health. So now is the time for us to seize the opportunity to advocate for the services and care that we know young people need. Next slide, please. So what are some of the things that we need to do? We need to connect individuals to appropriate care, and we have opportunities to do that through primary care, through integrated and co-located community mental health models. We can expand access to care through tele and virtual mental health care, increasing school-based mental health support in the middle schools, in the high schools, and at the college and university level. Families need support and help getting to resources. So increasing navigation resources will go a long way, and addressing our financial systems that impact our ability to access care. Next slide, please. Workforce is definitely an area that needs to be addressed, and there actually has been significant focus on allocating resources to do that. We also need to train different types of professionals. It doesn't need to be all doctoral level professionals. It doesn't all need to be licensed clinical social workers or MSWs or LPCs or APNs. We can do task sharing. We can think of different ways to provide care. We can teach professionals who work with children to execute some common factors from evidence-based interventions that will allow us to expand care. And then we're launching the 988 crisis line, and that'll be an opportunity for people to be able to access care immediately. We need to support expansion of care in community mental health centers. And then we need to invest in research for new practice models and invest in diversifying our clinician workforce. It's totally appropriate for families to expect that they actually can receive care from providers who have cultural similarities and similar ethnic backgrounds. Next slide, please. There's opportunities for us to protect the mental health of youth by investing in early childhood and school-based prevention and intervention programs, supporting student success, supporting justice-involved youth, supporting children who are involved in child welfare, strengthening supports for preventing inappropriate practices for online use for children, and to prevent targeting of young people by companies online, similar to the information we've learned about Facebook. And we also have an opportunity to spend more time looking at social media's, not just their harms, but also its benefits, since social media plays such an important part of most young people's lives. Next slide, please. So what can we do to forge a path forward? And I think together we can do that. You know, I recall an old African proverb that I think about every day. If we want to go fast, we go alone. If we want to go far, we go together. And that's the path forward. We have to bring a heightened awareness to the mental health conditions and the crisis that we're facing right now. We should work with our partners, with the American Academy of Pediatrics, the American Academy of Child and Adolescent Psychiatry, and CHA, and use the resources that have been brought together for the Sound the Alarm campaign for kids. We need to advocate to our representatives in Congress and the White House, however you want to do that, whether it's social media, phone calls, letters, but we need to tell our congressional representatives what we want. They're listening, and they're listening in a bipartisan way. And I think it's really important for all of us to be on the same page, emphasizing an apolitical mantra of what children and families need is the right care at the right time and at the right place. And we need to be able to connect all the systems that care for our children and encourage collaboration. Next slide. So what can we all do? We can all reach out to our lawmakers and tell them that these issues are urgent and we need to do something about it now. We need to talk to people that we interact with every day about this issue. And I'm talking about everybody, our friends, our families, our colleagues, wherever you are and whoever you're around, to make them aware of the crisis that we're experiencing now. And I would also suggest, what can you do at your workplaces? You know, share stories with the people in your environment. Share de-identified stories with your public relations people, your government affairs, about things that have happened to families that relate to the mental health crisis. And then all of us have to remember that we have a lot of tools available to us, and that we have treatments, we have effective treatments, and we have preventive interventions that really can support the development of mental health. We need to fight our own feelings of hopelessness about how overwhelmed we might be by what's happening now. We need to fight stigma. And we need to remind people that we live at a time where we actually have treatments, where children can get treatment and move on and have totally healthy lives. Next slide, please. So on that note, I will end my comments, and I welcome my colleague, Dr. Pao.
Thank you. Thanks to the Lourie Center members and staff, and to Louisa Holman and Alan Izawi for the kind invitation to join you all today, and to my fabulous, very energetic co-presenter, Dr. Tami Benton, who gave you a very comprehensive overview of what the problems are and how we can combat them. So it's truly an honor to be here with you today. Next slide. So I work at the NIMH, and I want to share with you that NIMH is the lead federal agency for research on mental illnesses. And we support more than 3,000 research grants and contracts at universities and institutions across the country and overseas, like the Lourie Center. And we also conduct intramural research, where I work, and support approximately 600 scientists working here on the Bethesda campus. NIMH is just one of 27 institutes and centers that make up the NIH, but we do lead the research on mental illnesses, and we're a fairly large institute. And it's important, as you've heard from Tami, that we conduct the research in order to provide you evidence-based practices. And insurance companies don't pay for practices that there is no evidence for. So it's very important that we actually have research data to show what works. Next slide, please. So as both Melissa and Tami, Marissa both mentioned, psychiatric disorders have their onset during childhood and adolescence. It's been well documented that lifetime cases of anxiety, mood, impulse control, and substance disorders, half of these start by the age of 14 years. Next slide. There are many challenges we face. The brain is an incredibly complex organ, and we don't fully understand it. However, we do know that development and aging are processes, and the brain will look different over time versus a snapshot in time. Different parts of the brain mature at different times in a non-linear fashion. And this is the data that actually showed that we use today, how the brain doesn't fully come online, the frontal brain and the cortex, until around 25 years of age, which is why adolescence and young adulthood turn out to be another really critical period in brain development. Next slide. So I'll just touch a little bit about research that we've started conducting since COVID. Next slide. The NIMH is currently providing research funding in areas I think will be of interest to all of you. Maternal exposure to SARS-CoV-2 and the impact on infant neurodevelopment, prenatal influences of isolation and stress on brain development, and disrupted early social exposure and learning on infants and toddler neurobehavior. So these will be kids who will be affected and come to the Lourie Center, and you will want to know what the data is on that. Next slide. So this is a little bit complicated, but it comes from a study of 169 preschoolers during the period of May to June 2020. And 46% of the mothers who reported on their preschool children between the ages of 2.5 and 6 were Latina. And 61% of the families had an income below a living wage, and 50% had at least one parent who was an essential worker. And 40% had above cutoff for referral for evaluation of depression, so elevated even relative to pre-COVID norms. But here, 64% of mothers during that period of time reported an increase in child externalizing behaviors, so disobedient, fighting, temper tantrums, as you can see. But the good news was during this study that they were able to see that practices of family routines that had more consistent routines robustly predicted better child mental health. And this protective effect persisted even after co-varying around income, dual parent status, food insecurity, and maternal depression. So essential worker status or parent layoff or furlough, none of those were associated with the child mental health symptoms. So it tells you that there are many pathways that we can ameliorate bad things that are happening in just controlling family routines that can influence a child's mental health and improve, if we help parent mental health, we help child mental health, we can improve parenting efficacy, we can do behavior monitoring, improve family cohesion, and just plain old help child sleeping. So all of these can be bolstered by family routine simply, and those are important skills that we can learn and help families with. Next slide. So we have to study and understand how policy changes affect mental health outcomes during the pandemic and in healthcare delivery. You already heard from Dr. Benton that state mental health administrative services are really important. And the development of telehealth, which was both a silver lining during the pandemic, may also be problematic now if we change the way that's been happening across state lines and we no longer allow practitioners to reach out to rural areas. So it's very important that we study the impacts of telemental health and how it's been helping youth outcomes. We also want to scale up interventions that we know are working, such as the family checkup online, to help foster resilient family functioning, as well as apply new techniques such as machine learning approaches to see if a single session intervention can help adolescent depression. So far that's not working alone, but we're still working at it to see what's the least amount of intervention we can develop across settings and scale up, because we have such a crisis, as you've heard described so aptly already. Next slide. So prior to the pandemic, NIH had made a huge investment with many institutes, including the National Institute of Mental Health, on a study called the Adolescent Brain Cognitive Development, or ABCD study. And that study started in 2015, and it developed resources to send monthly questionnaires to a subset of participants to collect data on experiences. And some children will be followed from the ages of 9 through 20 at periodic intervals, and they will have imaging sometimes and many comprehensive surveys. And then a subset has now been followed during COVID. So in addition, this ABCD study is frequently releasing new data to all researchers via the NIMH Data Archive. And sharing these data with researchers all around the world increases the rigor and reproducibility and engages scientists that don't work at the particular sites that these studies are being collected. Because if we can include more brain power from across the globe, we can learn more things. And to date, more than 60 papers have been published from this data since 2016 when it was launched. And that includes ABCD investigators as well as other investigators. You can go freely into the database. Next slide. So you can look that link up online. And so the supplemental collections of these subsets of these data, if we had not invested in the infrastructure prior to the pandemic, we would never be able to tell what the pandemic actually did to our children. So now we can collect data on mental health and stress, depression, anxiety, worry, and post-traumatic stress. And we have comparison data from pre-COVID days. Next slide. The CDC is also funding a longitudinal study of children ages 3 to 9 with autism spectrum disorder and other developmental disabilities, and in the general population of children who are more typically developing, ages 2 to 5. So there are many ways for you out there to participate in healthy studies. We need to understand healthy development as well as what goes wrong in development. And so having this pre-baseline information, as you can see, has been really critical. And so we hope to understand what the associations of COVID-19 mitigation efforts on children with autism spectrum disorder and other disabilities and their families can help inform us to prepare better guidance in the future. It was a real struggle during these last 2 years, helping these children stay in school from the isolation. And so we're going to use all that data to inform policy going forward. And unfortunately, if we have future health emergencies, that data will be needed. Next slide. We also are planning to study through funding made available through the American Rescue Plan. NIH is leveraging the investment in how to test for the virus and have safe return to school and the impact on our children. And we've been building this evidence for teachers to return children safely and how to staff this. And we have a number of projects in underrepresented minorities to show the impact of disrupted schooling. Next slide. This is just to show you that NIMH also provides many resources to the public on the latest evidence, and you can find it at this website. Now, I did just want to turn for a minute to the positive, because you've heard a lot of discouraging and worrisome news, and we want to talk briefly about resilience. So all people were affected by the pandemic, even those who weren't infected. And those who have mental illness were at increased risk for getting COVID-19 infection, but all people were in fact affected by this pandemic, you know yourselves. And so now even those without the virus are at increased risk for developing mental illnesses, particularly in the vulnerable populations that have been discussed. So how can we promote resilience? We of course have to attend to immediate needs such as safety, medical care, and food security. But we can develop healthy coping habits, active problem solving, healthy habits of taking care of oneself and learning to maintain a positive outlook and look for meaning and purpose through helping others. And a key skill for children to develop is how to access social support. If you can ask for help, you can get help, and that will help you in the future. Next slide. Next slide, please. So we know from many disasters and mass traumas, and this photo is from Hurricane Katrina, that most people who are exposed from trauma actually do improve over time, but there is a significant minority who might have long-term or chronic experiences with mental illness, and those are highly affected by social inequities and health disparities that exacerbate and predict the vulnerability in marginalized populations. Next slide. So the risks for outcome will be affected. Trauma outcomes will be affected by the nature and severity of exposure and individual differences. And greater social support, as I said, is an important positive predictor. So the risk factors listed here are only useful for predicting group level differences. So being female doesn't mean you're guaranteed to have PTSD, but, and we're very bad at predicting individual outcomes with a single variable. Next slide. Here's a resource for helping parents cope, but the main issue with helping children cope with traumatic events is to talk with them and help them identify and manage their feelings. And this is a guide you can download from the website. Next slide. So we hear the word resilience a lot. What is resilience? It's the ability to bounce back from a setback and then thrive and grow and be effective in the face of adversity, challenges, and change. There is always adversity and challenges and change. You can't protect your children from it. And if you try to prevent bad things from happening, that really is not a protective skill for kids. So here's a book from the AAP, the American Academy of Pediatrics, and another book on the blessing of a B-. So resilience is not the absence of struggle. It's messy, and it does not mean being immediately okay. It means learning how to come up with facing things and being okay. Next slide. There are 7 C's in that book of Building Resilience, Giving Children Roots and Wings. And they are around competence, confidence, connection, character, contribution, coping, and control. And as you can see, these are all about developing a sense of self. And as children develop, they have to be able to feel that they're confident and competent and that they can connect with people and develop emotional regulation and know what's right from wrong and develop a sense of purpose and that they have control over some events in their life. Next slide. So just a word about parents in today's world. We have to teach children how to handle the ups and downs of life. We can't prevent them from happening and we can't handle them for them. We have to let them suffer through some of them if we really want to do better parenting. Next slide. So I'm encouraging everyone to promote balanced parenting. I know the Lourie Center focuses on that, and we help parents and caregivers understand the importance of giving children control over their own lives in a developmentally appropriate way over time. And so it's just important that we give them increasing control as they get older. Next slide. Life skills that are key to protecting one, particularly from suicide, which you have heard is really increased over the last 30 years. We have to help kids think critically, develop a way to handle stress, understand conflict resolution, and figure out problem solving and coping skills that they can use to manage when they feel overwhelmed and they need to step back from things that they feel are an emergency right at this time. And they need to be able to learn how to distinguish what's a real crisis and what is something that can pass in a little bit of time. So resilience and life skills together will help our children be stronger. Next slide. Thank you. That's it.
Thank you. Thank you, Dr. Pao. So thank you both to Dr. Benton and Dr. Pao for sharing your expertise and insights with us today. For the next 10 minutes, we'll take questions. If you have a question and have not yet written it in the Q&A box, now is the time.
So welcome everybody. First, well, I'm Alan Izawi. I am Chief Philanthropy Officer at the Lourie Center for Children's Social and Emotional Wellness. I first want to really thank Dr. Benton and Dr. Pao for their remarkable presentations. You have given us a lot to think about and to act on. I love the one slide, what can you do? You can tell, you can share, you can raise, you can fight. So thank you so much. So as Marissa just said, we're gonna take approximately the next, we might shorten it just a little bit so we keep on track, the next 8 to 10 minutes or so for Q&A, as has already been mentioned. Any questions we do not get to, we will be sending out an email to all attendees, all who have registered, with all the list of questions and then responses to those questions. So let me begin. Actually, we have a number of questions in the inbox. The first question I'd like to ask and really open it up to Dr. Benton and Dr. Pao is, how do we safeguard the mental health of children while also recognizing and addressing the fact that parents are not okay? I'll open it up to Dr. Pao and or Dr. Benton, or both.
Marilyn, did you? Well, I'll start with a few comments. I think that's an incredibly important issue that families have faced throughout the pandemic. And, you know, but at the same time, I don't think it's necessarily, it's not necessarily a bad thing that parents recognize that they're struggling with the pandemic as well. You know, family have natural resilience resources. for some families, that the pandemic brought them closer together because they were at home more. But I think it's actually good for parents to be able to have conversations about the challenges of navigating the pandemic, not in a way that is frightening, but in an honest way, because how children will respond to emotional situations very much depends on what they see with their parents. And so being able to have healthy conversations about how you're feeling and what you're experiencing, how you solve problems, being able to say that, this is anxiety provoking for us too, or we're nervous because we don't know what to expect, is an appropriate conversation to have with a young person. And also that we will get through this, we will work with these challenges. I think for families who are struggling with more than those kinds of experiences during the pandemic and really feel that they're having a hard time holding it together, I do think it's appropriate to reach out to someone who can be supportive. That could be a mental health professional. It could be someone at your church or someone in your community or a family member. But I think it's important to talk with someone else who may be having similar experiences, or someone who can help you if you believe that it's more than just, I'm feeling overwhelmed right now, I could use some support.
Yeah, I totally agree with that, especially parents of younger children. They might not be sharing their anxieties with the children, but that social support is the single most predictive factor of everyone doing well with whatever medical illness they're having or whatever problem they're facing. That data has shown that over time and time again. So you are being able to learn how to ask for help is really a great lesson for your children. So if you can go find a relative or a mental health professional or someone to just lay out some of the problems, sometimes keeping a journal and just spilling out all the things that are on your mind so that it can be tucked away and it's not constantly circulating in your head can be a helpful technique. There are a number of ways to just try to help unload some of that mental stress that you're carrying around all the time.
That's terrific. Thank you so much. Here's another, well, actually, it's kind of a shout out. This is a shout out to fellow Sidwell alum, Dr. Marilyn Pao. So I thought I would make sure that I got that in. Here's another question. Why is there such a shortage of pediatric mental health professionals? I'll open it up to either of you.
Yes, that's a great question. So well, there's a lot of different factors, but I think that some of them relate to, the number of people who were going into the profession, particularly as it relates to child psychiatrists, an underserved area. And so it's a combination of things. So the amount of training that's required to do child psychiatry practice, some of the issues related to the cost of going to medical school really becomes a limiting factor. And, opportunities like loan repayment that allows people, or loan forgiveness that allows people to go out and practice after their training, would allow them to be more available in the public sector. So the other issues are that, the number of medical school spots are limited. So there's not an unlimited number of physicians who can be trained in the US each year. The same with psychologists and the same with LCSWs and LPCs. So for all the professionals who are seeking training, it's long times in school, it's high cost, it's having high debt when you complete your training. But in addition to that, there are other issues around licensure and professional practice that are imposed by states that determine who can practice. So I think all of those are factors that impact the availability of children's mental health professionals right now. And those are some of my initial thoughts.
It's also hard work and can be very heart-wrenching. And so many people will say to you, well, I can't do that. It's not fast work necessarily. So that also sometimes people want to have a quick cure or a quick fix. If you give antibiotics, the ear infection goes away. It's a lot more satisfying. Trying to help young people can be sometimes a little bit time consuming. It's an investment, but it's so rewarding. But it's not for everyone. So I think that sometimes is a barrier. A lot of adult psychiatrists don't want to go into child because it's actually two patients. You have to work with the child and the parent. And so it's twice the work in many ways. So that can be sometimes a barrier for some people. But as Tami points out, it has a lot to do with the long duration of the training and the cost.
But I do, in line with that, I have to say that I think we need to think about different models of care. And we need to start thinking about others who we can work with who are not mental health professionals, who can actually execute some of the things that the professionals are doing. So we're actually spending a lot of time partnering with pediatricians and nurse practitioners and family practitioners to increase their skills so that they can actually learn to identify some of the kids at risk and to be able to provide treatment for some of the kids who do not have complex presentations.
Right, and we also can learn from global practices in which they train nurses, midwives, peer people to train. You know, we have peer counseling in college, you know, so we might be able to use other resources.
Thank you. And if Marissa, I see you on, do we have time for, I hope, maybe just 2 quick questions?
Sure.
Great. This somewhat, again, follow-on question, open to either of you. What do you think is most needed to expand support for the early childhood workforce? What are the audience that's on today? What are things that they can do? What are things that they can be thinking about? How do they look to organizations like the Lourie Center to help support, and other organizations like the Children's Hospital of Philadelphia and even NIMH? But what is your thoughts about how do we expand that support for the early childhood workforce?
Yeah, I think as Tami pointed out, advocacy at the political level is important. Prevention's not sexy. It's not expensive, but it's not sexy to people. And so, you know, trying to convey the message that a little investment in something like Head Start or early, you know, Lourie programs or ECHO can have a long lasting effect. You know, trying to show 20 years later that having a Head Start in the Lourie Center really has healthier and happier adults, that takes so long to show that makes it hard, because people want to pay attention to very short durations of funding, 5 years at a time. And, you know, so getting people to understand that for children, we need more longitudinal data, and people have to be willing to wait for the data to come out. So really just continue to be a champion and fight, as it said in the previous slide, and keeping everyone's attention on, this is a crisis. This is our future we're worrying about. So we have to start. There are actually practices we know that are good and we don't do them. So sending nurses to homes when a mother has just had a baby and helping identify postpartum depression and helping the mother with some early parenting skills. We know that works in many studies over time, and that yet we still don't invest in that. We know that the good behavior game works in school, and we can do it with children and practice behavioral examples in school, and we don't invest in that. So it's a matter of taking the evidence and trying to have people ask for it and champion it in their environment.
Yes, I agree.
And I would just add to that, which clearly you must well know, but a few months ago I was reading a study that was initiated out of the Harvard University Chan School of Public Health and Dr. Nadine Burke-Harris. But why and how, while you said, Dr. Pao, prevention may not be sexy, but why it is so critical, because we now know there is a direct link to untreated trauma in childhood and 7 of the 10 leading causes of death in adolescent, adult, and later life. So that early intervention, that prevention could not be more critical at this time, particularly as the health system moves to social determinants of health and value-based care. But maybe 1, possibly 2 more questions. This question: how are generalists like pediatricians being approached to augment their interventions from the National Institutes of Mental Health, from the American Academy of Pediatrics perspective? Again, I open it up to either one of you.
Well, I can just say we recently partnered with the American Academy of Pediatrics and the American Foundation of Suicide Prevention and my own personal research group to work on the suicide prevention blueprint, which the American Academy of Child and Adolescent Psychiatry supported. And we are all actively working with pediatricians in primary care to help them develop ways to identify behavioral problems and mental health problems early in their practice and to get them more comfortable with asking the questions. They don't, if we all have a practice of let's not ask because we don't want to find out what it is because we don't have time to deal with the problem and there's no one to send them to anyway. So there's kind of a barrier there. They don't want to look for it if they can't do anything about it. So, but we have to identify these patients and find resources for them. And we're all working together with our county resources and political resources to try to find ways to manage these children.
And I just also wanted to highlight that the American Academy of Child and Adolescent Psychiatry, the Children's Hospital Association are working together very closely to develop strategies for educating pediatricians around mental health treatment, identification, how to support children and families, and how to work and how to respond to some of the things that come up as it relates to mental health. We're also, we partnered with ACAP, partnered with the American Academy of Pediatrics and the Children's Hospital Association to issue the joint declaration of a state of emergency. And the organizations are continuing to work together around developing strategies for addressing the mental health crisis that includes educating pediatricians more broadly and equipping hospital centers and healthcare organizations to be able to respond to the mental health needs of young people. So those are ongoing initiatives that we'll continue to focus on over the coming years.
I may just have to stand here.
Pardon me?
It's not going to fit. You're not going to be able to see down.
Oh, one last question, and just looking at time. This question here, we are investigating schools who may be deficient in recognizing children with psychological issues. Is there a contact number or organization, I'm guessing maybe a parent or patient can reach out to? Any reaction from either one of you, Dr. Pao or Dr. Benton?
So they definitely can reach out to the national organizations that are involved with children's mental health. But in every state, in most states, most schools have actually started to integrate some basic interventions around teacher training. And many of them have actually started to implement mandatory training for teachers focused on recognition of mental health and or suicide prevention. And so, it might be a good idea to check with your local school board about what is actually required for schools in your region. But there's also an opportunity, if you look at some of the national organizations, like the National Alliance for the Mentally Ill, they actually have products that can sort of guide you around how to identify who to contact to address some of the barriers. But most states actually have started to require that teachers undergo some kind of training. In many states, it's mental health first aid to help them recognize problems, but most states have mandated some kind of training at this juncture, and it would be useful to find out what's happening in your own state.
Yeah, in high schools, the JED Foundation partners with high schools to try to promote information. I'm not sure what the equivalent organization is for preschool and early intervention, but there definitely are foundations that worry about that.
Well, let me end there. I wish there are many other questions in the queue. As I said, we will follow up with all attendees and everyone who has registered with questions we could not get to. We will provide responses to. You're welcome to contact any of us, both Dr. Benton, Dr. Pao, anyone here at the Lourie Center. And so Dr. Benton, Dr. Pao, really personally, and I know we speak for the Lourie Center, Champions for Children, and all of us in this field to really try to make lives better and change the trajectory for children. Thank you so much for joining us and really imparting your extraordinary experience and knowledge to help us all understand what we can do to act and make lives better for children and change the trajectory of their lives. So God bless you and thank you. Marissa, I'll turn it back over to you.
Thank you. Thank you, Alan. I echo your sentiments. It's now my honor to introduce our very special guest. Ingrid Burford is the parent of a child in the Lourie Center Head Start program. Brian Mack is the Vice President of Education with Teaching Strategies. Brian is going to speak briefly about the partnership between Teaching Strategies and the Lourie Center. As the Vice President of Educational Content, Brian oversees the instructional design of educational resources and professional development initiatives that support educators and families. Brian's passion for empowering educators with innovative, high quality, and developmentally appropriate classroom resources, coaching, and implementation support are inspired and informed by her experience in the classroom as a pre-kindergarten teacher and program director. Tamika Tremaglio is the Executive Director of the National Basketball Association and is the National Honorary Chair of Champions for Children. Tamika is the current Executive Director of the NBPA. In this role, she works on behalf of NBA players to ensure their rights are protected and that they are fairly compensated for the tremendous value they bring to the court and as ambassadors of the game around the world. Tamika began her 4-year term as Executive Director in January 2022. Prior to joining the NBPA, she worked for Deloitte as the Managing Principal for the Greater Washington area. We'll now hear from Ingrid.
Good evening. How exciting. Thank you all so very much for the opportunity to support this event, America's Children's Trauma Crisis. So as a parent and a mother of 3 beautiful girls, also a victim of recent trauma myself, I do understand firsthand and have firsthand knowledge of the need for programs and services like those offered through the Lourie Center that supports our nation's mental health crisis. Being able to deal with mental health really starts with early relationships with my child. And so my youngest girl, again, who is 4 years old, is a recipient of services provided by the Lourie Center. And so as a result, I was able to participate in one of the center's most esteemed programs, the Circle of Security Parenting Group. And this was referenced during the opening remarks. This group hosted an 8-week session for parents like myself who have children who have experienced trauma at some point in their life. And it was co-hosted by the center staff, Mr. Max Siegel and Ms. Maria Della Reduso, 2 phenomenal facilitators. Now, the purpose of this Circle of Security was to help caregivers like myself connect more with my children in a real way. And this Circle of Security utilizes a circular figure model as a central visual, which depicts certain interventions for caregivers, all of which are really focused around helping myself and other parents as caregivers reflect upon our children's attachment needs in order to promote and secure attachment with our children. And through participation in this program, I had 3 very distinct takeaways that were really instrumental in my application on how I bond with my children. So first of all, it really helped me to become more aware of the concept of attachment and what that really meant. And we all figure that, if we're spending time with our children, that it constitutes proper developing the attachment that our children need. But through the Circle of Security, I was really able to glean that attachment is really much more than that. And also learned really distinct ways to stay in tune with my children and to know when they have that need to attach. My second takeaway from the program was understanding and learning what my child needs and making sense of what they're asking for. The session truly helped me to understand that if I can get to hear the needs of my children, then their lives and even my life will actually be much smoother. And these include things like supporting their exploration in a safe and secure space, and so on. My third takeaway was really understanding what it means to meet my children's needs. And often as a parent, I tend to give my child what I think they need, versus finding ways to understanding my child better. And so during the session, I was really able to glean from other parents and also learn from their experiences that helped me to realize I really was not alone in my misconception of understanding my child. I found the circle of security to be one of the most valuable services that the Lourie Center offers. I'm truly appreciative of the opportunity to have participated, but more importantly, I'm really appreciative of the structured supports that it offered to me and my children. Thank you so much. I'll turn it back over to our facilitator.
Thank you, Ms. Burford. Thank you so much. Now we will hear from Ms. Mack.
Thank you so much. I am humbled to be invited to speak on this panel, and thank you for all of the great wisdom that's been shared up to this point. As Dr. Leslie mentioned, I am here representing teaching strategies where we offer the most widely used curriculum and assessment resources related to, as well as family engagement and professional development, and have been for over 40 years as we look to iterate and be responsive to the needs of the early childhood field. And as already been clearly articulated this evening, the field is quite literally drowning under the weight of the trauma that has surfaced in the past couple of years. We did a recent survey of our partners out in the field, and over 4,000 teachers responded to us with really devastatingly high declarations of unsustainable stress. And the most stressful aspect of their work they articulated as not being able to meet the social emotional needs of the children and families that they serve. So we're talking about children's mental health here, but we have to think about who are the caregivers that are showing up every day for these children who need it so much and who are struggling with their own trauma. You can click to the next slide, please. We know what those mitigating factors are to help support in this work. A lot of them have been discussed already this evening, but in a field of education, there's only so much we can control there. But what we think we can uniquely help support in the education space and at teaching strategies, and we actually feel a responsibility, is to support the field with resources that help teachers' ability to create those secure, trusting, and nurturing relationships. We can click one more. It's these trusting relationships that we know are the only way to begin breaking this cycle of dysregulation that we can see in children. And quite honestly, I've been doing this for quite some time, and no one demonstrates this better than the teams at Lourie Center. It has been an unbelievable, inspiring honor to get to see this work in action with the teams at Lourie Center. But the reality is not every child who's experienced trauma has access to the caring expertise and resources provided by the Lourie Center. So we need to think of ways to take what we know works at Lourie Center and the strategies that they've refined and help others across the country replicate and benefit from that work. We'll click one more. That's why we're so excited to have recently introduced a new solution to the field that was directly informed and influenced by the strategies and approaches of the Lourie Center. It's a research-based teaching partner that's designed for preschool, pre-K, and even into early elementary school that provides the guidance, strategies, and personalized coaching to help teachers create the trauma-sensitive, relationship-focused learning that can begin to mitigate the impacts of the trauma and ACEs that we've talked about. But we needed to prioritize it in a way that supported children, proactively with strategies that we can model, but at the same time caring for that teacher and prioritizing their own self-care and reflection on trauma with a robust library of professional development. And then lastly, family support. What's the language that we're using with families to help navigate some of these tough conversations related to trauma? And when you think about the high levels of turnover that we're talking about in the field right now, people from National Guard and substitutes with no background entering into our classrooms, they need access to get up to speed as quickly as possible of the best ways to respond and in caring, relationship building ways to the things they may be observing in the classroom. So Thank you for giving me a moment to celebrate and thank the Lourie Center for the work that they put in partnership with Kylie and Tia and us here at Teaching Strategies as we hopefully continue to evolve what the solution can look like to support the needs of the field. And we can skip my last slide, Dr. Leslie, just to make sure we save time for Tamika.
Thank you. Thank you. Ms. Tremaglio, Tamika, I'd love to hear from you.
Hello, thank you so much, Dr. Leslie, and thank you so much for having me. I strongly believe that the work that's being done at the Lourie Center is God's work, and thank God that they have been here, particularly during such a challenging time. As you mentioned, I'm Tami Benton, and I'm the Executive Director of the National Basketball Players Association, and I have been in this role a little more than 100 days, and so I miss, of course, being in Washington, D.C. and being where we are really in a place where we've been incredibly impactful for kids. So of course, it's my privilege and my honor to serve as the honorary chair of the Lourie Center Champions for Children. The Champions for Children is a network of women that I'm incredibly proud of who inspire, influence, their experience and relationships to help raise funds for everyone within the organization. I want to give an enormous thank you to Paula, who really has led this from her heart. She's been incredibly passionate, and I feel it's a privilege to serve under her leadership. I also want to say that you are truly an inspiration, that you have demonstrated phenomenal things, and that all of the things that you continue to do are so incredibly supportive for our organization. Prior to COVID, there was an alarming number of children who struggle with feelings of helplessness, depression, and thoughts of suicide. In December, which was obviously a rare public advisory that we heard from our Surgeon General, Dr. Murthy, they issued warnings among children and the youth in which they said that the COVID-19 pandemic was far greater than any of us had ever envisioned, that its effect on mental health has been incredibly devastating. And America's children are in a crisis of ongoing adversity as parents struggle to navigate the pandemic, and our children, certainly since COVID began. There's been research that's emerged that shows that some babies are developing differently than they did before COVID-19 pandemic. And not only because of the exposure to COVID itself, but likely because of the stress and social isolation that actually has occurred. Children that have been born during the pandemic have reduced verbal, motor, and overall cognitive performance compared to those born pre-pandemic, according to a study that was at Brown University. This in and of itself is really challenging and hard to stomach. Mental health emergency departments visits rose by about 25% in children between the ages of 5 and 11, and over 175,000 children have lost caregivers during COVID. And sadly enough, suicide attempts by young girls has increased by over 51%. As you all know, it is Mental Health Month, and I love that we have been really focused, even as an organization. We have a campaign on Be There, Be Safe to protect one another. We're doing this in combination with Born This Way Foundation, with the WNBA as well. And as Dr. Murthy went on to assert that the future well-being of our country depends on how well we support each other and invest in this next generation. It makes it critically important. And as the National Honorary Chair for Champions for Children and a member, I commit myself to making sure that we increase the awareness for this valuable center and providing my help in whatever way God allows me to do so. I'm committed to this role because the Lourie Center meets an unprecedented and extraordinary need in our community and our region. And I'm now a part of improving not only the social and emotional health of our children, but the social and emotional health of our families. We all do have the ability to change. We have the ability to lead a life of significance that is affecting the next generation to come. So thank you for this incredible honor and the ability to serve as the honorary chair.
Thank you. How inspiring. Thank you, Ms. Tremaglio. And thank you, Ms. Burford, for sharing a little bit about your family's story. Thank you, Brian. And again, thank you, Tamika, for your commitment to children's mental health and to the Lourie Center. That concludes our program for today. Thank you to all who took time to learn about the mental health crisis affecting so many of our children. If you would like more information, or if you know of a child who is at risk and you need guidance, please contact the Lourie Center, and the information is posted. Thank you for your time.